Hello Facebook. So if you just caught us on TV5 News at 9, you know what we're talking about today. But in case you didn't, we're here with Health Yes with Genesee Health Plan, talking about the Karmano Cancer Institute's Healing Through Art program, which is a very exciting topic today. Here with two lovely women. Why don't you guys introduce yourself?
Well, I'm Linda Hammacher. I'm President Emeritus of Genesee Health Plan, and I am a cancer survivor.
And I'm Erin Keith, and I'm the art therapist at Karmano Flint.
All right, wonderful. So just so you know, if you're watching this at home or wherever you are, we can see our comments. So if you have any questions along the way here, please put them in the comment section. We'll be able to see them and answer them for you. All right, let's just kind of recap a little bit about what we talked about at TV5 News at 9. What is the Healing Through Art program all about?
So the Healing Through Art program is a program designed to help anyone touched by cancer, whether it's survivors or their family members, to help them cope throughout the journey. So this could be with anxiety, depression, grief and loss, pain management, whatever it is that they need help with coming through the door, because a lot of times we're addressing the physiological effects of cancer when you're at a doctor's office, but we also need to address this growing need to address the psychological effects that are ongoing after being diagnosed with cancer.
And what is this program primarily, who is it for?
So it's not just for survivors who are in treatment, but also if they're post-treatment, as well as their friends, family, spouses, children, really anyone touched by the experience, because it doesn't just touch the person that's going through the treatments and cancer, but also the family members just as well, so everyone involved. And
what is Genesee Health Plan's involvement with this program?
Well, Genesee Health Plan is partnering with Karmano for this program and for some of the other services that are provided there in order to help the cancer patients in the community to have the tools to manage some of the things that Erin just mentioned, stress, grief, depression, anxiety, all of those things that go along with a serious disease. And Genesee Health Plan believes that prevention, of course, is key. Early diagnosis, of course, I can't stress this enough, because 1 out of 8 women are going to be diagnosed with breast cancer in their lives, and we're talking about all types of cancer here, not just breast cancer. But when you think about it, it's pretty overwhelming, and breast cancer alone is going to kill probably about 48,000 women this year. So it's something that touches, cancer is something that touches all of our lives, and we want to make sure that people get diagnosed early. Genesee Health Plan pays for all kinds of cancer screenings, and certainly mammograms, and we want to encourage women, especially to go for their mammograms, and for men to, of course, go for their PSAs, and just to be generally aware of your body, go for your physicals, and see if we can't get things diagnosed sooner.
Now, I know you have a personal connection to the art therapy program. Can you tell us a little bit why this is such an important thing for you?
Well, when I was diagnosed with breast cancer, I was so focused on the treatment and just getting to the point where I didn't have cancer anymore. And it's something that is just so all encompassing. It takes over your life, the life, the lives of the people around you, your family, and you just want to get through it. And once I was through the treatment, then I found that I was having a really hard time sort of moving on, getting on to the next level, learning how to manage anxiety and depression and those kinds of things, that it's almost like a PTSD kind of an issue. And I discovered the art therapy program, and I just can't say enough about how it helped, because it gave me the tools that I needed to move forward in my life and get on to the next chapter, which hopefully will be cancer-free.
Yes, of course, and just a fantastic program. So we mentioned how GHP is involved in the program, but why is that partnership so important for Genesee Health Plan to be involved in the art therapy program?
Well, again, our focus is on prevention and early detection. And we see this partnership as a way of giving back to the community and hopefully encouraging the community to use this program as an alternative to maybe you won't need an antidepressant, or maybe you won't need anti-anxiety drugs if you have the tools that you need to handle these things on your own.
Do you have to be a patient to participate, or being in treatment to take part in this program?
No, absolutely not. So you could be in treatment, although just like she was saying, is that sometimes you're in survival mode.
Yeah.
And so sometimes you don't even, you have doctor's appointments after doctor's appointments that it doesn't even cross your mind that you need to address your psychological health as well. And a lot of times, a lot of people don't see that until after, when they're trying to figure out life after cancer, or if they have a chronic cancer. So it's important that you can come at any point of your journey, whether you're in treatment, post-treatment, or like we said before too, for those that are caregivers, that and you have a friend or family member that's going through this experience, a parent, spouse. But also the beautiful thing is also that it's open to the community. So it's not just for Karmano's patients, it's open to the community at large for anyone that's been touched by cancer.
That's really incredible. How much does it cost to take part?
That's the other thing, is thanks to the support of the programs from the community and GHP, there's no cost.
That's awesome. That's incredible. So why are health and cancer screenings so important? I know you mentioned it a little bit, that Genesee Health Plan is really great about trying to help people to do that, but why is that something that's so important to do?
Well, certainly with many kinds of cancer, the earlier that you can get it detected, the less radical your treatment will need to be, and the greater chance you'll have of surviving it. And I guess I've spent a lot of time in waiting rooms with a lot of other cancer patients, and it's pretty evident the people who did not get diagnosed early and are quite a ways down this road before their treatment begins, and the people who were diagnosed and treated early, there's a big difference in not only the treatment but the outcomes. So we're just very interested in having this available to the community and in encouraging prevention, early detection, and then how to deal with the situation afterwards.
So do you do you have to be living or staying around the Genesee County area to take part in the art therapy program?
No, you do not.
Okay.
Nope. We're open to the community and anyone that's been touched by cancer. So like I said before, if you're a caregiver, survivor, our doors are open to you.
So does Genesee Health Plan cover all cancer screenings?
Yes, and I'm going to brag a little bit.
That's okay, that's what we're here for.
When Genesee Health Plan first started back around 2001, 1,200 low-income women in Genesee County were getting mammograms. And after Genesee Health Plan, we averaged between 8,000 and 9,000 a year of paying for mammograms. So it's just, and we also cover all kinds of cancer screenings. And again, that's what we're focused on, is prevention and early detection.
So how and why was the art therapy program created?
So we've been noticing a growing need to address the psychological effects of cancer. And like you were saying, to provide the coping skills to do so.
Sure.
So the beautiful thing about art therapy is it allows you to externalize what you're going through and put it onto paper. So that not only that you can show other people what you're going through, because it's not easy to find the right words to express it, but also for you to get a new perspective to look at it. A lot of times when we're talking about things, we're very deceiving, whether we know it or not. So with art therapy, the truth comes out and it gets onto paper, and you can get it out of your body so that you can learn ways to cope with it.
And create beautiful art.
Absolutely.
Fantastic. Like this one here. Tell us about this.
Yeah, so with this piece, we actually did an exercise with art about letting go. And throughout this process of learning to let go, because in cancer you don't have control over your doctor's appointments, your diagnosis, and so on, and all these emotions that are coming up, these fears. So it allows we're practicing on letting go of some of those things. And so this provided an opportunity where not only could the survivor cope with that, but also she realized after making it that this was a perfect reflection of her journey.
That's incredible. So go ahead.
No, I was just going to add that
it's beautiful.
It does. Yeah, it's very cool. There are all different kinds of art that are done. Not only paintings, but all kinds of multimedia, altered books, little metal sculptures, all types of art that come out of this program, and it's really reflective of the journey.
And I'd like to add to that, the thing is I get all the time is, well, I'm not an artist, so
yeah.
can I come? But the reality is you do not have to have any art experience. And I would say about 95% of the people that come in have no experience coming into the door. So it's not about making something beautiful. It's about the process of making art, what you're learning when you're making the art, and how you can grow from that experience.
Fantastic. So after they've done the art, grown from the experience, that kind of thing, can the patients display their artwork?
Absolutely. So we've already provided some opportunities for the artwork to be displayed around the Cancer Center. So not to only share with other people, but also to take pride in their work. Yeah. But then also we are planning on having an art show coming up this fall through the Flint Institute of Arts. So we try to have different ways to also showcase the artworks that are made, because telling your story is extremely important and for it to be heard. So we'll provide the opportunity.
You absolutely want to be able to present what you've made too.
Yeah.
So how is Genesee Health Plan partnered with Karmanos?
Well, we are supporting them financially in some ways in order to make sure that the art therapy program is staffed appropriately, and we're working with them on ways to, events like this, to get the word out, because it's not a program that I was aware of, certainly. And I think that a lot of services that are out there are sort of not very well communicated. And even though the art therapy program has been there for about 10 years now, it was not very well known to the community as a whole. So we are partnering with them to do some joint things to promote it, and also we just want to make sure that the community has access to this type of a program to help them, again, handle some of the effects of cancer in their lives, to hopefully that they don't have to take prescription drugs in order to get through it, or they don't have to be depressed.
Right.
Or they, it's just so that you can sort of move on.
That's another option for them.
There you go.
We have a question from Linda Lee. She says, I'm getting a mammogram as soon as I can. This is a wonderful program. Thank you. Not a question, but wonderful. Thank you.
Yay. Yeah, it doesn't have to be in October. Everybody thinks October is the pink month.
Right.
And that's when you go for your mammograms. But you have to go according to your doctor's schedule. And, what happened to me is, I was supposed to go in May, and my husband was very sick, and he was very sick all summer. And my primary care physician's office called me in October and said, did you go for that mammogram back in May? And I said, no, I haven't. I've been so tied up with my husband. And she says, well, you better go, because your physical is coming up. And I went, and there it was. So if I would have continued to put it off, I could be in a much different situation right now. So I just can't stress, we're all, we're mothers, we're wives and sisters, and we all have things that we have commitments, but there's nothing more important than committing to yourself and to getting your physicals, getting your mammograms, for men to get their PSA, all kinds of cancer screenings.
Mm-hmm.
And I just wanted to add, too, that depending on your family history and so on, too, you might start your screening a little bit different than someone else. So the best thing that you can do, too, is talk with your doctor and see when you need to start screening and how often, because it might be different for each person.
So what about the classes themselves? Are they classes? Are they sessions? Is it kind of like walking into, your middle school art class?
I get that a lot. So there is some similarities with an art class. And those similarities are, you come in, we have all kinds of different art supplies that you can try to use and experiment with. And I will teach you how to use the materials and the supplies. But then there's the therapy component. And that's something that you wouldn't necessarily get in a classroom, where not only will I come with an art directive for you to explore, sometimes I allow you to figure that out yourself and, whatever it is that you need to get out that day. But then you get to share with it with the group. And there's been so many times that I see someone else and they're like, that resonates with me. Yeah. I get that. And how powerful is that? That not only are you being able to show the world what you're going through, but then someone else is like, me too. Mm-hmm. You're not alone. So the therapeutic component is what's different. But as you come in, and like I said, most people don't have any art experience coming in, that's perfectly fine. So whatever it is, whatever questions you have, I teach you how to use the material, and there's not a wrong way of making art. The beautiful thing is that it's a reflection of you, and there's no wrong way of that. That's something really raw and beautiful that you get to provide for everyone and yourself.
It's beautiful. A community, too, you create out of it, sounds like.
Yes, absolutely. Mm-hmm.
Wonderful. All right, we have a question from Jenny. She wants to know if it's available in Bay City.
That's a good question. I don't know if it's available in Bay City particularly, but she can come to our facility and participate in our programming.
Okay, good to know. So are there any other programs besides art therapy to help cancer patients?
Yes, so we also do have some support groups that are available. I know we specifically have one for prostate cancers, and as well as a general cancer support group for men and women, and to just gather that the art therapy program is for men. I know a lot of people think of women, but it's for everyone.
Sure.
And then we also have a young cancer support group for anyone diagnosed before the age of 55.
Okay. So there's another great question just right off that. Is there an age requirement to take part in the art therapy program?
So we do have certain programs that are designed for different needs. So I do have some programs that are just for survivors. I have some programs that are just for caregivers and some that are combined. And then I do have some programs that are for families. So a lot of our programs are 18 and older unless they do have the cancer themselves. And then I'm more than happy to adjust our programming for their needs. But then we have different things designated for different things. So I would say anything under 18 would probably be our family programming.
Okay. So does Genesee Health Plan cover treatment if someone on the plan is diagnosed with cancer?
Well, the first thing that Genesee Health Plan would do is to try to make sure that that person is in the coverage that is that they are eligible for. Is it under the Affordable Care Act, or also known as Obamacare, or would it be Medicaid or Medicare, to try to get them into a full coverage program, because Genesee Health Plan generally covers outpatient services. But GHP does help take care of patients until they become effective under the appropriate coverage. And so we're really proud that we're able to get people into the right care. Before the Affordable Care Act, it was very difficult because we were having to ask for charity care for cancer patients. And one of the experiences of someone that we both know, Gail, who used to work for the art therapy program, she was diagnosed with cancer, and her insurance company dropped her from coverage.
Oh, wow.
And under the Affordable Care Act, they can't do that anymore. And they can't limit the amount of dollars that go toward the coverage, where they could say, oh, well, I'm only going to cover you for $1 million, or whatever the amount was. So everyone thinks of, well, pre-existing conditions is the biggest deal to do with the Affordable Care Act, and there are some other very important provisions in there to help people who are diagnosed with cancer and other serious diseases.
So on the same topic of money, how is the art therapy program funded?
So our program is funded through different grants and donations. So it's important that we have our community support, which we do have, and that's very important, so that it can be free for our participants that participate in the program.
So much fantastic things we're learning about this program today. It's just wonderful. And I know we're kind of being told to wrap up a little bit, but if you still have questions about this after we've ended this live segment, you can certainly still post your questions in the comments. We'll try to answer those for you. But if you still have more questions, you can contact GeneseeHealthPlan.org or the Karmano's Cancer Institute Healing Through Art. We'll have those numbers posted for you as well. I just appreciate you both for being with us today.
Thank you so much.
Thanks for having us.
Yeah.
Such a fantastic program and beautiful artwork, and thanks for letting everyone know about it. And until next time, Facebook.